Member of the House Energy and Commerce Committee, John Shadegg, and Congressman, the president, you just heard him. He seems like he's still optimistic, but boy, when you can't even get the markup in the Commerce and Energy Committee, what does that say about this health care bill?
Well, I think it says that there are a number of conservative Democrats who recognize that the current draft bill does not control costs. The head of the Congressional Budget Office, nonpartisan position, came in last week and said the current bill in the House and in the Senate would drive health care spending up and increase the burden on the budget. Those Democrats are saying to their president, Mr. President, this bill doesn't work and we want changes in it.
And those Democrats, though, are coming out and saying, wait a minute, the CBO's not including other things, right? They're not including A and B, and if we carry the 3 and we bring down the 0, it's all going to come out in the wash.
Yeah, it'll all come out in the wash. Let me see. When was the last time we enacted a government program and 2, 3, 5 years down the line or 20 years down the line, it cost less than what we were told when it was originally enacted? I don't remember that government program.
Yeah, one of the problems they're having, Congressman, here is we get a ton of email. What Americans are concerned about is the fact that now we just had Representative Clyburn on just a moment ago saying that he doesn't really want to tax the rich now, but he wants to have it as a trigger mechanism, that in case he needs to tax the rich, we can do that. But he thinks the numbers, the system will pay for itself. It's kind of like stimulus, right? We got stimulus 7, 8 months ago, and they said unemployment is going to be at 8%. Those numbers were wrong. Why should America trust these numbers?
Well, they shouldn't. I mean, this is called trust us legislating. I just heard Mr. Clyburn say that he wanted this tax in there as a trigger and that it wouldn't be pulled. There's nothing in the bill that says it's a trigger. It says it will kick in. There's an escalation that makes it much, much higher if costs keep going up, but there's nothing, no trigger that says it won't go into effect. I don't think the American people on an issue as important as this should just trust Washington politicians. I think they ought to be able to see this bill. They ought to be able to read this bill. They ought to be able to learn about this bill. And right now, it's being rushed through so quickly that no American has a chance to do that. I hope that the Democrats that are at the White House today meeting with the president say to him, we need to slow down.
Quickly, what do you make of Steny Hoyer coming out and saying, you know what, August, not going to happen?
Well, I think it shouldn't happen. Last night in committee, we offered an amendment that said that nothing in the bill would allow a federal employee to tell a medical practitioner how to practice medicine. Nothing in the bill would allow a federal employee to tell a doctor how to practice medicine. That amendment was rejected by the Democrats. Every single Democrat voted against it. I don't want a federal employee, bureaucrat or otherwise, between me and my doctor. I want a health reform plan like Republicans are proposing that is bottoms up and that puts reform in the hands of people, lets them make choices, and puts us in control, not Washington in control.
Arizona Congressman John Shadegg. Congressman, thank you, sir. Well, look